Nasogastric insertion. During the assessment phase, we will check the doctor's orders, assess the client's conscious level, assess for allergies, assess for any history of nostril surgery or a deviated septum, assess for any nostril occlusion, review the client's medical history, assess the reason for the nasogastric tube, assess the GI status such as bowel sounds, distension, and pain, assess agency policy for use of water or normal saline to flush the nasogastric tube, assess agency policy for placement verification. During the planning phase, we will gather our equipment, obtain assistance if necessary, plan for frequent oral care, and plan to maintain a patent airway. Good morning, Ms. Jones. My name is Stacy, and I'm going to be taking care of you today. I have a doctor's order that we need to place a nasogastric tube. Do you know what a nasogastric tube is? Let me explain that to you. It's a tube that's going to go in through your nose all the way down into your stomach. You've come in with what's called a small bowel obstruction, and this is going to hopefully relieve a lot of the nausea and vomiting that you're having, as well as to resolve that small bowel obstruction. It's going to be a little bit uncomfortable while I'm doing this, but I have an assistant here, and this is Deborah, and she's also going to be helping out as well. A couple of things that I need to go over with you at the beginning, Mrs. Jones, is that during this time, you're going to feel like you can't speak, but you should be able to talk. But let's go ahead and develop some hand signals, okay? Why don't we do a thumbs up if I ask you if you're okay, a thumbs down if you're not okay, and if you need me to stop at any time, why don't you just put your hand up as in stop, okay? Okay, what I need to do first, Mrs. Jones, is I'm just going to go ahead and kind of just listen to your abdomen and do an assessment, okay? At this time, I just want to go ahead and get a baseline, and so I need to listen to her bowel sounds. Again, I want to make sure that I raise the bed up to my working level. During the procedure, I'm going to go over everything with you, step by step, okay? You need to make sure that you really look at the abdomen, see if you notice any kind of distension. Listen to bowel sounds in all four quadrants. Now, you may or may not hear any bowel sounds, but you do need to have a baseline to go by. At this time, if you needed to, you could very gently palpate to see for any kind of distension as well. Okay, Mrs. Jones, the very first thing that I'm going to do is I'm going to set you up, okay? And I need to set you all the way up into a 90-degree angle. Now, during my planning phase, I made sure that I planned for assistance, which I have. Also, I plan for any kind of equipment, and I will go over each equipment pieces with you. Okay. What I want to go ahead and do is I'm going to put the side rails down. I need to make sure that I have a suction canister, that it's hooked up and that it is working. I would turn it on and then just make sure that it is properly working. And then I'm going to have all of my equipment here. I'm going to need a towel, which I'm going to lay over my patient. Mrs. Jones, I'm just going to lay this right here, okay? I'm going to need an irrigation set. I'm going to need a cup with a little bit of water and some straw, and this is what I'm going to give to my assistant. The doctor's orders say that I need a nasogastric tube for suction, so I'm going to need a Salem sump. I'm also going to need a pen light, a tongue depressor, tape, a connector that will connect from the NG tube to the suction canister, a safety pin, and also a pH strip. You need to make sure that you check your agency's policy to see how they verify placement. Most agencies require a pH strip so you can make sure that the contents that you receive back is acidic so you can verify that you are in the correct place. I'm going to go ahead and put the bucket right here, just in case if my patient gets sick. At this time, if you needed to, you could still, like before, ask the patient if they had any kind of deviated septum, nasal surgery, had a broken nose in the past. If none of that has happened to the patient, you can also ask your patient to close one nostril and breathe out and do the same on the other side. And that way you can see which nostril is going to be the most patent. Also take a look inside. The right side looks pretty patent to me, so that's the side that I'm going to go on. The very first thing I'm going to do, Mrs. Jones, is I'm going to measure so I know how far down I need to go to get to your stomach, okay? You want to get the very end that's going to actually go into the patient first. And you're going to start at the tip of the nose to the earlobe and down to the xiphoid process and about 1 more inch after that. Then you can mark your tube. You can mark it with a pen or you can mark it with a piece of tape. After I've marked my tape, I want to go ahead and get my tape ready for once I've dropped the NG tube down. You need to get you a piece of tape that's just a couple of inches long, and you need to make a split, but not all the way down, just about 3/4 down. And just put it on a bedside table or somewhere where you can get to it easy. And then get another piece of tape. This is so in case you are by yourself and you don't have an assistant, you have access to everything. And then if you would like, if you think that you're going to need more tape, you can just roll out the tape and then just also put it on the bedside table. Okay, once I've gotten my tape ready, I want to go ahead and apply my gloves. And you only need to put on clean gloves. This is not a sterile technique. Now I'm going to go ahead and get my NG tube and I'm going to go ahead and lubricate it. When you lubricate it, make sure you put as much as you can on it because it will help it go down a little bit easier. Okay, Mrs. Jones, let me explain everything that I'm going to do, okay? As I begin to insert this NG tube through your nose, I need you to tilt your head back as far as you can. This will help it get through the nasal cavity. When you begin to feel it in the back of your throat, will you just let me know so I can stop for just a minute and then take a look inside your mouth. As we begin to advance, I'm going to have you begin to swallow, put your chin to your chest and swallow, and take a couple of sips of water that Deborah's going to give you. Is that okay with you? Okay, are you ready to begin? All right, Mrs. Jones, here we go. Let's have you sit all the way up. Now, for camera purposes, I would be holding the NG tube up a lot closer to the nasal area, but that way you can see it. I'm going to hold it a little bit further back. All right, Mrs. Jones, are you ready? Here we go. And advance, and she may raise up her hand and says she feels it in the back of her throat. Okay, so I'm going to go ahead and stop at this time and just hold it right there. Don't let go or you'll lose it. At this time, I want to go ahead and get my pen light and take a look in the mouth, and I can see it in the back of the throat because you want to make sure that it doesn't begin to coil in the mouth. And if you needed to use your tongue blade, you can. You can have your assistant hold on to the tube, but with the patient having their mouth open, I can see just fine. Okay. All right, Mrs. Jones, are you ready? Chin to the chest. Are you ready? And swallow. And swallow. And swallow. And swallow. And swallow. Very good. Swallow and swallow. That was wonderful. All right, now I've gotten to my marking so I know I can stop. This is when you're going to need to get the piece of tape that you made a split on. Put the top part that doesn't have a split onto the nose. And then you're going to get just one at a time. And I know this may be a little bit difficult with your gloves on. And just wrap one of them around. And then get the other piece and wrap the other one all the way around because you want to secure it. You okay, Mrs. Jones? All right. At this time, if I needed to, I'm going to go ahead and I'm going to put another piece of tape right across, again, just to secure it. Okay, so the next thing that I'm going to go ahead and do is I'm going to verify for placement. With my irrigation kit, I want to attach it to the very end. And when you look at these NG tubes, you will notice that a lot of them will have pigtails. Do not use the pigtail. This is used as a vent. So you want to make sure that you attach it to the very end. At this time, I want to go ahead and pull back. And I'm hoping that I'm going to see greenish, brownish, maybe even dark coffee ground drainage. That kind of lets me know that I am in the right place and I am in the stomach. But just to verify for sure, I want to go ahead and I'm going to get my pH strip and I'm going to test it. So you can use your basin. Put your pH strip inside the basin. And again, make sure you leave this bucket here because again, because I pulled some of that NG tube content out, it may begin to still come out. So leave it in the bucket right here. And then I'm going to just put some of the content on my pH strip. And then I'm going to wait for just a minute or maybe even 2. And when you test the pH strip, you want it to be below 5. That tells you that you're acidic and you're in the right place. Also, check your agency policy to see. Some places may want you to do a chest x-ray to verify for placement. So again, it's very important that you know how the agency verifies for placement. Once I have assessed that my pH strip, it's a 2, so I feel very comfortable that I am in the right place, then I'm going to go ahead and attach it to suction. I'm going to turn the suction on to whatever the doctor's order had said. With this doctor's order, it said attach NG tube to low intermittent wall suction, so that's what I'm going to put it on. You're going to need your connector. And again, don't attach it to the pigtail, attach it to the other part. At this time, I want to go ahead and make sure that it's turned on, low intermittent wall suction, or whatever the doctor's orders have stated. Okay. Mrs. Jones, I am just about done. I'm just going to secure this. How are you feeling? Okay. Now what I want to go ahead and do, at this time if you need to, it may be a little bit easier without your gloves, and that's fine as long as you don't have any content. You can dispose of your gloves. And what I want to go ahead and do is I want to secure the NG tube to the gown. Get a piece of tape. You want to make sure that you get enough leeway so your patient can turn their head side to side and not pull on it. Because you definitely don't want to have to do this again. And what I'm going to do is get my piece of tape and then I'm going to put them together. And I'm going to get my safety pin, and through the tape, not the tube, I'm going to safety pin to the gown. Okay, Mrs. Jones, I've secured your NG tube to your gown. How do you feel? I want to go ahead and put up my side rail. Would you like the pillow back behind your head? Can you raise your head for me? Mrs. Jones, I want to make sure that you understand a few things. Don't ever lay down flat. You need to be at least about 30-degree angle at all times. If you start feeling that you're becoming nauseated or vomiting, you need to make sure that you call me and let me know, okay? I want to go ahead and lower the bed all the way down. And go ahead and gather all of my equipment and put it away. Mrs. Jones, I'm going to give you your call light right here by you, okay? Again, you call me if you're having any kind of pain or discomfort, and also make sure that you call if you feel nausea or any kind of vomiting, okay? Okay, thank you very much. During my evaluation phase, I want to evaluate placement of the nasogastric tube, the patient's status, and also to make sure that the patient has equal breath sounds.